Dr. Shehnaz, you specialized in ENT and later practiced in the UK. Now, what differences did you notice between the healthcare system of Pakistan and Britain?
I noticed a large number of differences. For one, patient care was excellent. Patients were not neglected as they were in some of the hospitals in Karachi. Nurses used to ignore them there. Here, this didn't happen. And patients were respected, and children were treated very kindly. In Pakistan, conversely, people were rude to them. Bibi, Baba, they would shout at the
Exactly.
patient. And, and children were treated very badly. They were dragged, threatened, frowned at, warned to behave themselves. They were examined and, they cried and no one showed any sympathy. Treat very, very kindly, very nicely. So children actually respond to doctors without fear. And I think
Oh,
that's something Pakistani medical system needs to learn. But there were some other aspects which were not so good. I found that actually our standards of medicine were higher, our standard of knowledge was higher because we read big books like Gray's Anatomy, Davidson, and Love and Bailey, which British graduates surprisingly didn't read. Many of them were written by British authors. Those authors had now died, and British doctors are reading thin notes and handouts.
okay.
And when I took plan, I passed it in the first attempt. I found it easy because of our high standard endowment. I think most of my classmates passed it first time as well. And one of the questions they asked me was about benign tumors which cause death, and we talked about all the endocrine tumors and all. Now, after I joined the NHS and I discussed this with British graduates, they said they didn't know it. And they said, oh, those are FRCS questions. We are not expected to know them.
Oh,
And I found that their standards were really low and our degrees were higher. And to some extent, I was demoralized, wondering what I would learn there if this was what it was. In the district general, they are the same as us. You don't see anything new. Teaching hospitals have things that we don't have in Pakistan. And I was lucky. I worked in top teaching hospitals like Manchester Royal Infirmary, Queen's Medical Centre, Nottingham, Leicester Royal Infirmary, King's College Hospital, Royal Free, where I saw excellent ENT. I did my ENT jobs there. But in the UK, there are a few other things. There's a lot of racism, which we
oh,
don't have in Pakistan. In Pakistan, अपनी गली में इंसान शेर है.
बिल्कुल.
यहाँ racism बहुत है, and overseas doctors are great victims of racism. And GMC was created essentially in 1965. It was given powers for fitness to practice at the demand of the BMA, the Great British Medical
Medical
Association,
Association.
to get rid of foreign doctors by striking them off.
Okay.
That was the first plan of a racist steering group set up at the behest of the BMA. BMA was concerned because before 1964, the doctors who came here, they did their exams and went back. There were jobs in their country, so it was no problem. But there were others who didn't pass their exams. They stayed here. And in 1964, Canada opened its doors and British graduates went to America. Their jobs were vacant, especially the district hospital jobs, outbacks, which no one wanted, GP jobs. And overseas doctors stepped into them. And now BMA was worried and wrote a letter to the Department of Health. There was no Race Relations Act, so they used racist language. They said that we are very concerned at the number of overseas doctors in this country. Uh, we At the moment, they said if things continue in 10 years, one third of the medical profession will be non-white.
Okay.
And in 20 years, more than half will be non-white. We need to keep the British medical profession whiteized, in inverted commas, whiteized. So we need to get rid of them. So a big group formed, and their decisions over the years influenced all of us. They affected all of us without exception. First, they set up the fitness to practice proceedings of the GMC, but unfortunately, they could only strike 20 doctors off a year. That wasn't good enough. So then they used the royal colleges to accredit senior registrars before making them consultants, and wouldn't give senior registrar jobs to overseas doctors, hoping that they would leave. But doctors didn't leave. That was the whole problem. They
Eh,
found something else to do. And then there was this brilliant idea to stop those who were abroad from coming by de-recognizing all the degrees. And they set a date. They kept it a secret because they did not want floodgates to open. But the date at which they were originally going to de-recognize every single foreign degree was 31st December 1971.
okay.
Now, and if you remember, we had the December War just before that.
Yes.
And Mr. Bhutto walked out of the Commonwealth. He took us out. This gave them a brilliant idea. They wanted to turn the Pakistani public against Mr. Bhutto. So they made a change to this plan. They decided to postpone all the other de-recognitions to a later date and only de-recognize Pakistani
Pakistan.
degrees. Yeah, to give people the impression it was a knee-jerk reaction to leaving the Commonwealth, but it was not. And of course, people blamed Mr. Bhutto for it, and we were all affected by that de-recognition. And then they de-recognized the others at later dates. But then man proposes, God disposes. Doctors stopped coming. They were going to America, the Middle East. So the royal colleges here, which relied on overseas doctors to take up their exams, the Scottish colleges, Royal College of Surgeons of Edinburgh, 90% of their candidates were from overseas. And they started going bankrupt. And they ran to the government and said, look, we are becoming bankrupt. You've got to let them come here to take our exams. So that led to then TRAB and PLAB and all the rest. So BMA was always behind all this. And we took the can for it. And when I came here, they would pretend as if it was all government policies, but I joined the BMA and became very active in the BMA and actually infiltrated every single committee of theirs.
Okay.
And although BMA and I are now enemies because I founded a rival trade union, Locum Doctors Association, they are the ones who gave me all the the medical political training, all the committee training. When I went to all these committees, I realized I had a flair for them. And
Okay.
because those dealt with employment law and other issues, including legal issues, that made me get an interest in other areas of law in addition to medical law.
So, very interesting. But still, I see that there are so many overseas doctors. In fact, I think that without overseas doctor, NHS would not survive. The way
Exactly.
the way the doctors are working, our doctors overseas are very hardworking, very intelligent, and they are supporting a lot to the NHS.
Oh, yes. I mean, they are unrealistic. The overseas doctors are effectively the backbone of the NHS. I
Yes.
mean, European doctors were too. And after Brexit, they left and there's a gap in the NHS. But the truth about them is that although they need us, they don't like us and they don't want us. And they keep looking for ways to get rid of us. This is a sad reality.
This.
They can't settle down to the fact that they can't live without us and they should live with us.
I
And
think
now they've been warned because lately all three parties are competing with each other and promising immigration and to send everybody from here packing home. And people reminded them that if this happens, your NHS will collapse straight away because it relies on overseas doctors. But
exactly.
even though we are such a help to them, they are not grateful to us. They use us as slaves. They treat us like slaves. And now the rules they have made are designed to make the overseas doctor just a pair of hands, come for, say, 3 years and do unrecognized pair of hands jobs and go. They won't be allowed to bring their families and spouses in. And the cost of living is enormous. And they are made to pay thousands to use the NHS and for registration and other overheads. And they are the first to be victimized by the GNCO when something goes wrong. So I'm afraid the life of overseas doctors has not been easy. Many have committed suicide, especially because of GMC actions.
Oh,
There's a tendency to report non-white doctors to the GMC. I was appointed to their panel and I was given training and I was shocked at what they trained us to do. Entire training consisted of the mechanism of racial discrimination. They would show you a set of cases. Turn to page XYZ. It was the case of a white doctor, somebody like Robert Jones or James Brown. And she told you this is how this case is decided, okay? Then she asked you to turn to another page where there was a name like Raja or Patel or Khan. And she would say, this is how you treat this. And there was a complete difference in
Yes.
how they were treated. To give you one big example, there was a white doctor, a GP, who had raped 4 or 5 patients, sexually abused many. He'd gone to jail for 2 of the rapes, and 2 trials were going on. Now, when the doctor gets a criminal record, the GMCs automatically send the judgment. And because the court had found him guilty, GMC could not find any way out of that. So all they had to do was decide, was this professional misconduct? If so, does it need sanctions, and what sanctions? These 3 questions are in the hands of the GMC panel, now MPTS. Now, they could not deny that rape is misconduct.
Yes.
So they admitted that, but they decided that, and you can't not sanction, the public would have rioted. But what sanction did they give him? A warning, a rap on the knuckle, don't do it again. They left him to practice and abuse and rape women
Oh my God.
outside. And we were told this is how to decide this case, okay? And then the second one for comparison was an Indian GP, and he had an impeccable record. But one patient sent a word of mouth complaint that he had sexually uh,
Been
misbehaved
harassed.
with her. Yeah. And it was something which was unproven. It was just a word of mouth. And 200 women, patients of his, actually wrote letters of support saying he had always been professional, very, very well behaved. There was no proof that he had done this. But they found him guilty of serious professional misconduct and struck him off. And we were told this is the way this case is decided. In other words, if it's a black, you
Ah,
strike them off as far as possible. If he's white, you let them off. And there were 1,000 people who were appointed to these panels, including all these Overseas Doctors Association people. Many of our Dow graduates were there too. And it's interesting how the GMC offered people perverse incentives that if you sit on our panels and do this, you can get OBs, MBs, and knighthoods. You get to rub shoulders with VIPs, royalty, aristocracy. You get money. They all sold out and they all went along with it. And at the end of it, there was a gag clause to sign so that they will deny it if you ask them outside.
ah,
I was the only one who protested and said, this is inconsistent. One person has raped, you've let him work, the other guy has done nothing that is proven, and you've struck him off. And this woman kept giving me looks as if you don't know why you are here, do you? You don't understand. You are here to help us strike these people off by sitting as a locum and an overseas doctor on our panel. Because if you are sitting on that panel, there's less chance of a racial discrimination case because you can't be accused of discriminating against your own race.
exactly.
I walked out. I was the only one who walked out and didn't sign the gag clause. And after that, they have been terrified of me ever since then in the GMC. So I'm one person who bashes them freely and they wet their pants and listen quietly. But this is happening here. And overseas doctors are victimized, and there's a large suicide rate as well, and a lot of stress. So you can't deny that there's a major problem in the system, and the system is unrealistic. I think a time will come now when the NHS will collapse completely.
These are harsh realities when you are working abroad and you are facing the system is against you. But still, I find that Pakistani doctors and the other doctors, overseas doctors, they are really doing very good as far as postgraduate education is concerned. And the patient they prefer to be seen by overseas doctors. In fact, the Britishers they want that they should be seen by overseas doctors. And this is, I think, it's the part of the early training which we have been imparted by our seniors.
Yes, you're right, because we were taught to treat the patient's disease,
Yes,
and clinical care was our priority. In
exactly.
Britain, I'm afraid the priority is resources and finances.
Ah,
So they do finance oriented medicine. Is it good for the NHS? Is it not? Can a patient live with this? If they can, why treat them? So you often get patients saying that I went and saw this doctor, my doctor, they did nothing. Then I came to the casualty and saw this Indian doctor and he gave me medicines and I'm better. This is common.
Exactly.
And my patients have always liked me. They've always said, can I see you again next time? It's true. We are actually far better than them. And as I said, our degree actually is superior.
Yes.
And I know that you might possibly consider asking me something later on as my guest, but my view is that when we go abroad, we actually belittle our degrees. We take exams like lab and ECFMG, accepting that our degrees are unfit to be recognized and inferior and substandard, when in fact it's the other way around. Now, we should not be doing that. We should learn to recognize that our degree is superior and not any less than theirs. I've seen a
Exactly.
lot of incompetent American doctors as well. There was a stupid doctor on an airline with me from Yale who wanted to treat a patient with pulmonary edema with sedatives.
Oh my God.
So this is an American
Yeah.
doctor for you. So we are far better, and we now need to change our attitude. We need to regard our systems, our education, and our degree as superior and second to none. And
Exactly.
we need to develop our systems and make them superior, grab the good things from them. Yes, send some people there to get ideas and things and bring them, but actually develop your own and become and see yourself as the first. Don't see yourself as second to others.
Exactly. And here I would like to salute Lieutenant General Wajid Ali Barki and his team, who in 1962 laid the foundation of the College of Physician and Surgeon Pakistan, and that is providing the specialists for the country, and almost now 80 to 90% of the specialists, they have been trained in Pakistan, and Alhamdulillah, they are doing good job.